Congressional Republicans are moving ahead with a budget package that includes significant cuts to Medicaid. The goal, gutting federal Medicaid funding and shifting it over to cost to states. So what does that mean for health care in Arizona? We asked President and CEO of the Arizona Hospital and Healthcare Association, Anne Marie Almadine. Good to see you again. Thank you so much for joining us.
Good to see you.
Okay, so Congress administration, they're debating cuts to Medicaid. You're saying that these cuts to Arizona healthcare would, I think your word was devastating.
These cuts would absolutely be devastated if Medicaid is reduced. House is trying to find $880 billion to extend the Trump administration tax cuts, and they're looking at Medicaid to do that. And that would just have really significant consequences for the whole healthcare delivery system in Arizona, for people on Medicaid and those in the private sector as well.
Let's define terms here real quickly for those who aren't aware. What is Medicaid?
Medicaid in Arizona is called AHCCCS, the Arizona Healthcare Cost Containment System. And we have over 2 million people in Arizona who are on AHCCCS, who receive their coverage through Medicaid. And it's important to note for those people that they have regular insurance cards. It might be different United or Blue Cross Blue Shield Health Choice. So it looks like private insurance, but it's actually the Medicaid program.
Interesting. Okay. There's a trigger law in Arizona as well when federal funding gets below, I believe, 80%. Is that correct? And what does that mean?
What that means in Arizona, when we expanded Medicaid, when we restored and expanded Medicaid back in 2012, part of that included a provider assessment, a hospital assessment that funded our state match, our state share. If the federal match, which is at 90% now, goes below 80%, that provider assessment goes away. So there's a real unraveling of the whole Medicaid program if that federal match goes below 80%.
And that unraveling obviously means cuts. What kind of cuts? Specifics, please.
I think as we're looking at Medicaid enrollment, currently there's 2 million people on AHCCCS in Arizona. That's 1 in 4 Arizonans. It's up to 750,000 Arizonans might lose their health care coverage, which is so significant for those 750,000 patients. Access to health insurance is an important way that people get access to care, that they can see primary care providers and do preventative screenings for cancer and manage their chronic conditions. And this would be taken away, that ability to really manage. And what do people do when they're sick? They put off care and they go to the emergency department when it is an emergency. And that's just not really the setting that is intended to care for patients with chronic conditions.
Well, I remember back in 2012 when we talked about this, and the uncompensated care was a big deal for hospitals because, as you mentioned, going to the emergency room for all these things is not what emergency rooms are designed for. Uncompensated care, is that going to be a big issue again here?
It absolutely will. History has the potential to repeat itself. I think if we don't organize and really make our voices heard in terms of how we feel about health care for all Arizonans. But I think there's a real risk of us repeating what happened during the Great Recession, and that was the state froze enrollment for a certain population in Medicaid, and we saw when the enrollment decreased, uncompensated care increased exponentially to a point where hospitals really couldn't sustain it. There was a lot of cost shifting to the private sector, meaning hospitals couldn't cover that cost of care, so they would cost shift to commercial insurance companies or lay off employees or reduce service lines. All of that is really possible again because we know what's going to happen. People still need care. They still need health care. Are we going to provide it in the primary care setting and really help people stay healthy? Or are we going to reduce that access to affordable health insurance and leave the emergency department as the only option?
What is the impact on smaller hospitals, on rural hospitals?
I think across the board, there would be a detrimental impact across the system. But certainly for smaller facilities and more rural facilities, the impacts are that much greater. Their operating margins are much lower, and they actually have a higher percentage of Medicaid population in their communities. So I think rural Arizona has a lot at risk. As you may know, we already have maternal health deserts in Arizona where OBGYN services are few and far between in some communities, and I think this could really exponentially increase the number of OBGYN deserts in Arizona. We want to have safe, reliable, high quality access to care. And I think fundamentally these cuts really jeopardize that.
Lower reimbursements, again, I think you may have referred to this, but lower reimbursements to hospitals, these sorts of things. CMS payments as well, delay in CMS. First of all, what again are we talking about here?
So what we have been talking about is reductions to access, and Congress has not yet acted. So we really need to engage, make our voices heard, that we don't want this for Arizona to prevent that from going into effect. But in the current state today, CMS has not paid $1.15 billion in payments to Arizona that really helps the safety net system in Arizona, and what is something that has been budgeted by hospitals. And hospitals are in a really difficult place right now. They're looking at, are they able to make payroll? Do they need to reduce services? Do they need to close OB/GYN service lines? So there's some really hard decisions. Today, in the change of administration, there isn't yet a CMS director appointed, and then these payments are scrutinized by the Trump administration generally.
Well, and the Trump administration in general sees Medicaid as a handout. They compare it to welfare. Respond, please.
Medicaid is not welfare, it's health care. And I think it's really important part, and it's foundational to Arizona's healthcare system, so that there is a safety net when people lose their job. If you're a vulnerable person or you're elderly, that there is a safety net that you can have access to care. And I think with 1 in 4 Arizonans having access, this is our family, our friends, our neighbors. And I think just so much is at stake that we all really need to kind of get interested and really activate.
Does getting interested also mean in some way, shape, or form reorganizing Medicaid, doing things? I know that there's also the work requirement that always seems to come in and kind of come and go. But are these things that need to be reassessed and reconsidered? Arizona will be submitting the work requirements. Access has worked on that. The Governor Hobbs' administration is submitting this to CMS. It's something that's frequently looked at, but oftentimes has to be very narrowly tailored, because we are talking about a vulnerable population who might be disabled, chronically ill, and unable to hold a job. And so you need to make sure that it's really finely crafted so that it only applies to a certain segment of the population. Last question here. Have you spoken to the congressional delegation, and if so, what have you heard?
We've spoken to the congressional delegation, and we're really encouraging, hospitals and Arizona and statewide to really chime in with their congressional representative. And I think at this point, it's really along party lines. Certainly our Democratic senators and congressmen are looking to protect Medicaid. And I think with Republicans, we really want to make sure that we're making the case in terms of the impact to patients, first and foremost, the impact to the general healthcare ecosystem, kind of across the state, and then the impact to the economy. There's a very significant impact of these billions of dollars leaving Arizona, and the economic consequences in terms of job loss and other cascading effects. So as in Arizona, I want to see our taxes come back to the state, and I think this is an important way our tax dollars come back in a system that we can all participate in.
Anne Marie Elmedine, again, Arizona Hospital and Healthcare Association. Important topic. Good to have you here. Thanks for joining us.